Good evening, everyone. Okay, so we have Dr. Boon, Dr. Cindy, and Dr. Esther with us tonight. And I'm Soo Hin, and all of us are in medical profession. So tonight we deliberately invite the younger doctors here with us, so that you won't be seeing all the familiar aunties and uncles you've been seeing all this while. So something more exciting for all of you. Even though there are three of them only, Anna. Yeah, only three of them. Anyway, okay, let us start by some introduction. Okay, would you like to introduce yourself, telling us a little bit about your background, where you did your primary school, secondary school, and then how you study your way up to the medical school, and what's your plan what's your plan in postgraduate, or you're already a specialist? Explain your in which specialty. Why don't we start with the youngest one or the senior most one? I think I start with Cindy first. Cindy's got the broadest smile. Hey, before we go on, I'd like to commend Cindy and Esther. Both of you, I believe, are very good doctors now, because you're smiling all the time. The moment patients see you, they already partly heal already. Cindy, go ahead.
Okay, hi. My name is Cindy. I am currently in Miri. I'm in psychiatry. I'm a medical officer. My primary school I study in SK St. Faith in Kuching. Then to SMK St. Mary. Then went to Intact with Esther in Shah Alam. Then to Dublin in University College Dublin in Ireland. Then came back to Penang Medical College in Penang. Then I did my housemanship in Kuching. Then now I'm doing my MO-ship in Miri. Yeah.
Oh, you mean it's a training program?
Yeah.
The which? Okay, Esther, your turn.
Hi, my name is Esther. I'm from Taiping, Perak. So my primary school was in Kampung Jambu, is a Malay school in Taiping. Secondary in Church Methodist in Taiping as well. After that, together with Cindy, we were together for 7 years, pre-med and also medical school, and did housemanship in Taiping. Then got retained in Taiping for MO-ship in the medical department.
Right. Thank you,
Yeah.
Esther. So, Boon Wei's turn.
Oh, okay.
Can I interrupt for a second? What is MO ship, man?
Yeah, I was just gonna explain that.
Okay. Thank you, Boon Wei.
Yeah. So hi everyone. I'm Boon Wei. I'm from Penang. I am currently a urologist. So if you're wondering what urology does, basically it's a field of surgery, but I deal with plumbing, the human plumbing. So if there are any blocked pipes, urine can't run, that's my job. I studied in St. Xavier's for primary school and branch school in Ploticus, then secondary in St. Xavier's Institution. I did my undergraduate in Christian Medical College, Vellore, that is in Tamil Nadu in India. Following which I came back, and then I had to serve the compulsory service in government. In those days, you had to do I did an internship in India. So internship is basically you pass your exam, you are like a trainee doctor, not a full-fledged doctor yet. So it's called internship in India. Then I came home to Malaysia, and we had to serve 4 years of compulsory service. One of the years is to do what we call housemanship or house officership. So that's basically internship, so trainee doctor. Then after that will be 3 years of MO-ship, that's medical officer. So basically, you are confirmed in service, you are a full-fledged doctor, but you haven't specialized yet. This is the Malaysian system. Different countries have different system. Then after doing your MO-ship, you go into the field of your interest if you are able to. So sometimes it is up to the government where they post you. So in my MO-ship, I did all my MO-ship in anesthesia. So I almost gave Soo Hin a run for his money. I almost became an anesthetist, but the pull of the other side of the curtain was stronger. The force was stronger on the other side. So I went to the dark side. So that's MO-ship. Then in that time when you're doing your service as an MO, you hopefully get the feel of your choice. Like these ladies, they are very fortunate they got the feel of your choice, because sometimes it's difficult. You don't get your place. Sometimes they give you your choice, but in another place, maybe another state. So I think you're quite happy, I think, for the ladies to be in their field. Then in that time, you can train, get experience, and then sit for exams. So maybe we'll talk about that later.
Right, right. Okay, thanks, Boon. Back to the younger doctors. Do y'all, have y'all been wanting to become doctors from very young age, and why?
Maybe I'll start first.
Okay.
I wasn't very sure throughout school. I like everything. I was like more of an all-rounder kind of person. I like everything, including sports and everything. So I wasn't very decided until after SPM, when you have to make that decision where you want to go, and you're under some kind of stress because you don't want to waste your money or your parents' money for that kind of purpose. So I just applied for every single scholarship available because save parents' money. And my parents always like, just do whatever you want to do. So I just tried and shadowed some doctors, shadowed some bankers, and shadowed some economists, see what they do. And I found myself attracted towards medicine lah. I love the one-to-one conversations that we have with patients. I'm more of an introvert person, so I prefer that one-to-one conversation and that opportunity to kind of impact someone's life in a personal kind of way. And for me, medicine was a very intriguing subject. Like, it's very deep, very wide as well. It depends which way you want to go lah. So I chose medicine. Yeah.
Right, right. Thanks, Esther. I believe you made the very right choice.
I hope so.
What about you, Cindy?
For me, I think because like a lot, like I think I was in that kind of family where everybody is doctor, so everyone is asking you to be a
Oh,
doctor, that kind.
Mm,
But then
peer pressure.
again, yeah, peer pressure lah. Like my cousins are all doctors, and my mom's cousin are doctors somewhere. I also don't know where. And then, but then I think the turning point come when I think when I first accepted Christ in Form 3, I think, and then like then a series of events happened. Like my grandfather passed away, my mom got into a accident or something like that. So that was then like I decide I kind of like I don't want to be like I mean I figure if I able to like if I'm the one of the doctors, then at least I know what is going on and not just the layman term. I actually can help, like, and I mean at that point naively thinking I can help doing something like at that point of time. Then after when I become Christian, or like my some of the people in church say like, oh, this could be one of the way to spread the gospel. So like beginner fire, it's like very strong there. So yeah.
right, right. Oh, are your parents doctors?
No, they are not.
Okay, but you got a lot of relatives, close relatives who are doctors. Okay, okay. What about Boon?
Opposite to Cindy, I come from a family where there are hardly any doctors. There are very few, and the doctors in our family are not closely related. So I never thought about becoming a doctor. I don't think I would have had I tell you, I'm a very average student only. So the turning point was when I started attending church in secondary school. And then the initial church I attended was the Adventist church. So the Adventist church in Penang is also affiliated to the Adventist hospital. So always surrounded by the doctors. And during those times, there were a lot of expatriate doctors, missionary doctors. So they were very inspiring to see their life. After accepting Christ at 16 and all that, I figured that, I want to do something which is where I can help people, But I didn't think it would be medicine lah. But then somebody put that idea in my head that, you should consider it. Because like I said, I didn't think I was smart enough. Nobody in my family were doctors, and I didn't think my father could afford it. Then they talk about this college in India, which I could go to, which is cheaper and all this thing. So that's how that happened. But I think that even if that not happened, I think there were other ways also. that you can help people. So it's not always necessary that you have to be a doctor to help people. But I think being a doctor helps to put you in that position. No? And I also, there's a lot of stress about sharing the gospel, and being a doctor gives you that opportunity because people are in that frame of mind where they're looking for God. So, but even then, now I'm a doctor, I realize it's still not that easy to share the gospel. Yeah, so it's still working itself out.
Okay, thanks, Boon. Okay, can you all please tell us what is your, what do you do in a day's work? All right, it may vary, but maybe you can tell the young people roughly what do you do in your daily routine or daily not so routine stuff. Okay, so let's start with Esther first, lah.
Okay, so I'm in the general medicine department, which is everything else that doesn't require surgery. Like if you want to put it in a basic sort of way, you're the rubbish bin of the hospital. Yeah. So depends on whether you are working on a regular day or on call days. So I explain what on call means later. So regular days will be clinics because I'm basically in the medicine, which basically prescribes medicine and also monitor those chronic diseases. And then sometimes I'll be in the wards, which will be managing more ill patients, all kinds of diseases you see in Malaysian hospitals, from heart attacks to infectious disease. And for on-calls, those are different terms. For junior doctors, it's basically from 8 a.m., let's say you start today, till 8 a.m. the next day, and then you work your regular day until 5 p.m. So it's about 34 hours of work lah. So during that days, you'll be either in the emergency department, seeing which patients you need to admit to your ward, or you'll be in the ward taking care of those patients that need more special care. So medicine is mainly, it's not only prescribing medicine. You also have to perform procedures like inserting a central line, which is basically getting a vascular access or getting a form of way to give medicine in your sick patients, and doing some procedures like dialysis and stuff. Yeah.
Okay, thanks, Esther. What about you, Cindy? I believe you got a lot of interesting stories to tell. Hold on, I get.
Spill the beans.
So for my department, because we have several, I mean within my department we have several other tasks to do lah. It's either you're in a ward, or you are in the clinic, or we have this thing called community visits. I'll explain later. And also liaison team. Liaison team means like you have to see the patients who are inpatient, but they are currently receiving treatment, say for example in the surgical or in the medical department, but they have, say maybe they are stressed or maybe they are depressed or something. So you have to see them as a liaison cases lah. So on a normal day when I'm not on call in the morning, I will see my ward patients first. So average one patient will take about like 1 hour lah, because we have to ask a lot of things. Yeah. So yeah, we have to go into very emotional part and things like that lah. And then that's for one patient. So and then after hopefully they're done fast. I mean the only procedure that we do for my department is electroconvulsive therapy, in which you will have to give electric current to patients who are like in a very acute crisis lah, to help them. And then after that in the afternoon I'll be going, say for example if I'm in the ward, I'm usually also taking care of the hospital patients, which I call liaison. But if you are in the clinic, so meaning patients will come and after that you just see them for the clinic from 8 to 5. And if you're in community visits, like some patients, because they couldn't most of them are like they are very like poor and cannot come. They live like, for example in Miri, they live as far as like 7 to 8 hours away in the rural area. So but our scope are actually quite limited lah, because of our lack of manpower and resources. So we try to cover the community visits, to administer like injections for them, the medication for them, and check on their well-being. Usually they cannot afford the transport, because it's like transport to hospital will be costing about one way is about like 100 to 200 per person. And if they are not well and all, the family will have to bring them, so it's about 200 and return with 400 like that. So that is for on a normal day. If like like on call day, like what Esther said, you receive any people call you from the emergency department or from the ward, you will have to attend. Yeah.
Okay, thanks, Cindy. What about you, Boon Wei? You got a cozier life around.
Yeah.
No?
So Cindy and Esther, for those who are listening, are actually on working their way up to the consultant level where they've done their specialty. I have done my years there already. I was in government service for 18 years. It takes about more than 3/4 of that time to get where I was. So anyways, doctor's job is basically seeing a patient with or without their family. So for me, I see patients in three situations. One is in the clinic, and one is in the ward, and that would be the same like Esther and Cindy. But as a surgeon, the difference is that I see patients in the operating theater. So either it be the main operating theater or minor operating theater. So my day is when you work in a team in a government hospital, then you take turns. One day you do all clinics, or one day you do all wards, or something like that. But at my level and all that, I do everything. So I see patients in the clinic, then I run to operating theater, then I see the patients in the ward also, and all that. But being in private practice, especially with COVID, it's not so busy. So there is time for myself, but then the time is irregular, because the ladies, they have on call. So there are days that they're on and they can be called anytime, and days they're off where they cannot be disturbed. For me, I'm on call every day. So that is the problem. But when I'm on call, thankfully it's not as busy as when the ladies are on call. So when Esther and Cindy are on call, I think they are way busier.
I think medical ward can be a madhouse. Okay, can you please tell us what you like about your job, or what's fulfilling part about your job, and what you don't like about your job, but you still have to endure it and press on, and how you tolerate all these things that you don't like, and what helped you to overcome all the challenges. Esther, would like to have a go first?
Oh my god.
Well,
What I
be frank,
enjoy,
what you don't like.
yeah. What I enjoy is basically talking the conversations with patients and even their families. Because for me, treating someone is not only treating the disease, it's also treating the person. And also oftentimes you're not only treating the person, you're also treating the family, because they also need to understand what's going on. If they don't understand, then you can't really manage the patient well. So for me, I like the part of being able to walk through the disease with them, because those in wards, normally they are very scared. It's a new experience, or maybe they've been there before, but they don't know what is to come. So it's nice to be able to walk them through it. But I don't enjoy the on calls, because it's very tiring and stressful. And when you are just so tired that, but you still have to think and try not to make mistakes. It's basically more of a damage control sometimes, because you're just so tired and you just want to make sure your patient gets what they need lah. Yeah, and what helps me through it will be more of appreciating those little happy moments, joyful moments, and remembering why you're in this in the first place. Yeah.
All right. Okay. Thanks, Esther. Cindy.
I think mine will be also similar to Esther, like just that mine is like in terms of talking to patient, because my work will require me to know a patient from before they are born up until where they are at this present time. So it's basically like I know about their whole life story. Then to see, like maybe it's like you'll be able to see from a third person point of view how you can help them, or like for example how the adversities during your childhood manifested like now. So hopefully you can able to like walk through them through that. And because patients who come to me are either very like, in a way they don't have anybody else most of the time, like hopelessness and worthlessness and all that. So I'm like what my specialist said, we are not selling them certainty, but we are in a way providing them hopefully with hope to press on with life lah. And otherwise, what do I hate the most about work? You'll be on call lah.
Why you hate on call?
Because it's like they were like at any, because my cases are like when they come in, they are either like very aggressive, because like sometimes they are like or they are very depressed to the point they wanted to end their life. So if they all come together, I'm like and I'm the only one on call, so it's I'm scared what will happen to them should they proceed and all. Of course, like what keep me going is that will be like help from people like from the emergency team who help me to soothe the patient, or my colleagues who help out little here and there when I'm trying to see what's the problem, why the patient decided to behave certain way, things like that lah. And otherwise I think most of the time I will just I think God really sustained me. If not, it like being like absorbing people's problem and all sometimes can get very heavy on you.
Yeah,
So yeah.
yeah, it is. Yeah. Boon, what about you?
So I think I like my work because of the patients. That's what part of reason why I didn't quite like anesthesia. Because anesthesia, when I was doing it, I put the patients to sleep and then there is no relationship already. And then if you did a good job as an anesthetist, when you wake them up, they won't remember you anymore. That's part of anesthesia. Amnesia is part of anesthesia. So I like my job now where I can form relationships with patients. I like my job now as in private practice because I can have that time. I think when in government service, sometimes people forget how busy the doctors are, that you have to cover so much. You don't really get a chance to form relationships with patients and their families. So that is quite fulfilling for me. The other part of my job, which I like, is the surgeries. So I do surgeries, and much of my surgery is done through scopes. So I put scopes into patients, little probes into patients, and look at them. So for me, it's like a puzzle. So for people who like playing computer games and all these things, in fact, there have been studies that show that people who are growing up in the age of computer games actually become better surgeons than those who were before, the older generations, because you learn to work with your hand-eye coordination, making quick decisions and all those things. So for me, it's a puzzle which I like. Only difference is that if I lose the game, the patient dies sometimes. So that is the stress. The thing I don't like about my job is, again, like the others are being on call. So you always get called at the time where it's the most inopportune. For them, they are when you're MO, you're there already. But so it's just the hard part is being pressured all the time. For me, it's like being called at the odd hours and all those things. Now, just a extra thing I want to say is that for those people who say I don't like people, all these three people say they like the job because they like people. But if you like the cerebral part of medicine, because it's interesting, because it's a puzzle, like Esther and Cindy, they're trying to figure out what's the problem. So it's a puzzle. So there are fields of medicine where you don't have to deal with people. One is like Soo Hin, where he does anesthesia. You don't like them, you put them to sleep. That's it. If you really still don't like patients, then you can do X-ray, where you're in a little cave, dark cave, air conditioned, with a cup of coffee, and you're just looking at scans. If you don't like that, then you can look at cells, little cells and all that, work in the lab and all that. So there are many fields of medicine that suit for different personalities.
Yeah. Okay. It looks like all of us got something common that we don't like on call. Okay, I do enjoy talking to people, especially of late. I know I'm more mature than older now. Uh, Actually, we can be kind of reassure the patient a lot before the surgery. Now I tend to be more personal when it comes to talking to my patient. I try to reassure them, make them feel as comfortable as possible before going into the operation room. I think that 5-10 minutes of communication can make or break the patient sometimes. So if you communicate with them properly, if you show enough care and love, and to know not only them, to ask, sometimes I like to ask them about their family instead of their problem. So that kind of calm them down and crack a little bit of joke here and there, some compliments. That makes a lot of difference. Then after that, they forget about everything. Okay. A lot of people say doctors are very boring people, lah. Huh? Now let's touch on your hobbies a little bit, lah. Huh? Touch on your hobbies a little bit. Boon Wei, you start first.
Oh,
Oh, Boon Wei, very adventurous, lah.
I think I'm a very boring person because I find that medicine is very consuming. You know, it takes up your time and your thoughts and all that. Even when you're alone, you're driving, also you're still thinking about that problem and all this. So when I meet up with my friends who are not doctors, they talk about all sorts of things. They talk about finance, they talk about real estate, they talk about industry, computers, you know. And I'll be sitting there, you know, listening like they think doctors are smart, but when I mix with my friends, I feel like the stupidest person. I really don't know what is happening. But I have my passions. I like football. You can see on the wall there. Yeah. So, but I think it's important to have time for other things. So that is one of the things I try now. But earlier, especially when you're training, sitting one exam after the other, that's all you have to do. You know.
All right, thanks. What about you, Cindy? What's your hobby?
I sleep a lot.
Rina, you can join your club.
Then I go hiking. Also Esther introduced me to to it, and then we travel a lot also. I mean back in our uni days lah, but now because of COVID we can't. And then otherwise if not, and then what do I do? Oh, I just meet up with friends or like just still do like what people my age do, like go more lepak and then drink bubble tea, go to karaoke, go to movies. Yeah, I read books also lah, like non-medical books. Yeah.
Okay, Esther, I think you're a very outdoor person, right?
Yeah, I used to drag all my friends into hiking.
Wow.
So yeah, I love doing like ultra marathons and trail runs. So I'm normally like in the forest when I'm not working. I just like repetitive movements because it like help me to calm down. I don't have to think. So I just clear my mind and sometimes have that quiet time with God in the forest, and sometimes I swim. Yeah, so more of outdoor stuff.
Wow. Wow. I'm very impressed. Okay, now let's come talk a little bit about our faith. Okay. Do you find it challenging to be Christians in this profession, and can you please tell us how does your faith help you in this profession? Let's start with Boon Wei.
Like I said, I think that I'm very average. So when I do surgeries and all these things, I go with God. So that gives me the confidence when I go. Even difficult, complicated, complex surgeries and all that, I have that assurance that somebody is going with me, and that patient is in God's hand, and I'm just the instrument. But that still doesn't say that doesn't mean that I don't have any responsibility. So I still have to read up and get ready and all those things. It's when things go wrong and all this, then you really pray and all. You put yourself in that position, really when you take on difficult cases. And then God has delivered many times. So that is one of the perks of the job, where you can actually see, you could say, miracles. I haven't seen the dead rise, but I haven't awoken the dead, but miracles in smaller ways, yes. So that is the advantage of the job. The other thing about what Soo Hin was saying about getting your faith challenged, is when especially in private practice now, there is the temptation, to try to earn more, and Sometimes you can talk to patients in such a way that you can push them to that direction to get a surgery which they may or may not need. So that is a temptation when you're in private practice. So always have to be focused on service, and it's always the safest way. That you do the right thing, then there's not a problem. It's when you're tempted to make more money and all these things. The other thing is also time. Like I say again, medicine is very consuming. So the temptation is to take time away from God, take time away from family, just spend more time at your work, earn more, get more recognition. Sometimes people do work not just for money, but just for recognition, to be known as the best in town, best in the country or whatever. So these are the challenges as a doctor for me.
All right. Thanks, by the way. What about Cindy?
For me, it would be because my treatment with patients is mostly talking. So like they'll ask me like things like just few days ago, like there's a patient who actually come and ask me, like he lost all hope in life, and he asked whether I can just give him a jab and just let him die, things like that. And then or like you meet with a lot of like all those ethical issues in Christianity that you never really thought you would face it, but it's like it comes to it, and how is your response to your patients lah, things like that. Then there will be like some patients also who really like kind of tested your patience, like in the sense that where like what we call as revolving door patients, like sometimes they keep on taking drugs and all, but without you realizing is that you impose your thoughts on them, so it makes you like feel very annoyed with them every time they come. So it's like at times like this I always like have to take a step back and remind myself lah that they are who they are, like because of like their condition, and it's not actually who they are. So I'm also always reminded that they are also like God's children as well lah. So I have to like consciously remind myself, and to be tactful as well. Like also a few days ago, like when I have a patient come and ask me about whether or not it is right to I know whether or not he should get together with another guy, something like that, things like that. So it's like very sticky situation, because like as a Christian, like my beliefs may not agree with my patient's belief, but I cannot impose that on them. And also it's very tricky lah, so I have to be very, very tactful as well, because they are in a vulnerable position that whatever I say, they can interpret it wrongly, and it will go downhill from there, which is very scary. So but I most of the time I actually really have to rely on the Holy Spirit to really prompt me to know what to say at that point of time when patients ask me things, or when I'm about to consult them, things like that lah.
All right. Thanks, Cindy. Esther, how about you?
For me, being a Christian doctor, it's actually, I find it's in line with my values, because in Bible asks you to practice kindness, humility, compassion, and it's what we need to do as doctors on a daily basis. We need to show all that, and we need to have it in us rather than just putting on a face or a front, or pretending to be concerned. It needs to come from within you, then only you can impact someone. So for me, it's being in the medical line as a doctor, it's in line with what I believe in. I'm not really in any position of power to to ask for people to ask to curry favor with me. The most is like patients asking, can I cut the clinic line? So that's not really, it's nothing much that I'm in power to help them about lah. So the main thing will be time lah, like Dr. Teoh said. Medicine takes a lot out of you. You're very tired a lot of time, and sometimes you just don't want to read anything, or you just want to do nothing or just sleep, which is what we do after our on calls. It takes that conscious effort to put in time to remember that you are not just a doctor, you are also a Christian. And but the main thing is you are a Christian because it's what you will bring on to eternal life, basically. And being a Christian helps me because for me, I know that I'm not alone, even though during those rough on calls, I think medical and surgical probably are one of the more busy departments, whereby patients are generally more ill, and you sometimes you don't know what you're doing, because it's out of your level of thinking, like it's beyond human control sometimes even, and so you just rely on God, and you just pray that you get through it lah. So I think being a doctor, it makes you pray more, work closer with God. You need to be aware, like you're not the one healing people, it's God, and you're just a vehicle of God.
Yeah. Thanks, Esther. Yeah, that's very important. All of us are vehicles of God. Whether you're a doctor, you're an engineer, you're an architect, you're a chef cooking nice food. Huh?
Yeah.
We're all instruments of God. Yeah, very important to know that. Yeah, and just now, someone's asking us, do you think medicine is an art or a science? What do you think? Is it an art or a science? I'll say it's both lah.
Yeah. So obviously medicine is a science, yeah, because it's biology, chemistry, and some physics all involved. Lah. But then how you apply that knowledge is the art. So they always stress to us in med school that the difference between two doctors is how they apply that knowledge, and that is the art. Surgery in itself, it can be an art. I have seen certain surgeons who their movements are fluid. I cannot explain it except maybe Soo Hin can understand. He has seen some surgeons whose movements are like a ballet dancer, like that. Not belly dancer. Belly dancer also can. But very smooth, and it's very impressive. Yeah, so that is art in motion, but also art. So you don't have to be a surgeon like physicians. I've seen physicians, the way they think and all this thing, it's very abstract and all that, like an artist would think it, and then they come to an answer. Yeah, so definitely I feel art is an important part of medicine.
Right, and for your information, Boon is a good artist. He can draw very well. What about you, Esther? Medicine is a sport.
Yeah, it is an ultra marathon. It's never ending.
Yeah.
It's both art and science. I agree with Dr. Teoh. It's also a lifestyle in a way, to the extent that when we go out of medicine, we actually are quite lost. We don't really know what's happening outside. You live and breathe it.
Yeah. What about you, Cindy? Any view on that?
Yeah, I think it is like what both Dr. Teoh and Esther said, it is both art and science, but I think it shouldn't be just confined within the, like, I mean, there has to be a balance lah to it. Like, cannot be just live and breathe it lah.
Yeah. Okay, thanks. Okay, some fun questions. Maybe some of the young people or even some of the adults here watch a lot of Korean movie or some TV series about doctors, all that. So in your practice, have you all watched any of this? Did you all watch? You watch. So can you please paint a proper picture to them? Is your practice or your daily work anything near them? No, they're all so glamorous.
Yeah.
We don't have our own office. We mostly eat on the go, or if we get to eat anytime at all.
Yeah.
Right.
Doctors don't have time to put on makeup and dress up nicely. Basically, we dress in our pajamas and sometimes get a chance to comb our hair and tie our hair. That's about it, and then come to work. That's it. It's not glamorous at all.
Can I ask a question?
Right.
Yeah. For all four of you actually, because you're all doctors. Before you were a doctor and you were aspiring to be a doctor, you want to be a doctor, and versus when you became a doctor, is there a difference or a disconnect? Did you understand my question? Because I grew up with, I have quite a few friends that became doctors. They are usually the ones that get the best score, like first few position, right? Then they go to UM or whatever, and then they become doctor. And most of them like science, biology, but how much actually does that is that part of your job daily? You know, is what before you decide to be a doctor and after you become a doctor, are they matching? You understand what I'm saying? Because some of these young people may say that, oh, I really like biology, I really like this, so I should be a doctor.
Maybe I answer first before I forget. Old
Yeah.
already.
Yeah.
So I think to be doctor, yes, you need to be intelligent. You know,
Yeah.
you can't be a bottom class, but you have to be smart also. You know, so some of the doctors I know are not good doctors because they like medicine because of it as a puzzle and they are not very personable. So I think that is a shame. And then that is a very good question you asked you now about what we imagine we want to be and then what we are now. So I would say for me that I had an idea what a doctor would be like before I started, and I worked my way towards being that. You know, so you can get lost along the way. You know, and then so when you started off, then you have to have a real picture lah. So, for example, there are people who thought it was glamorous. Some people thought it's a good way to make money. You know, that's one of the dangers of medicine. But then you realize, you have to put in so much work. Really, the money is really not there. So usually we get students like our audience here who are at that time. So we get government scholar students who come and shadow us when we were in government hospital. So very often, every year they'll send a few of these students and JPA scholars and all. You're one of them, huh? So one of the first things most doctors will do is discourage them. Tell them, don't do. There are better things in life to do and all that. But then you realize so many people are doctors, and then you dig in, then you realize, there is satisfaction beyond the obvious. But money is always something I always discourage. There are better ways to earn money if you really think money is your thing. But I see that my colleagues, my friends who are in it for the money, they're not satisfied. They just see it as a job, just wait to punch the clock. I honestly say that I look forward to Mondays. You know, there's a point in time where I didn't. You know, I just loathe Sunday night. Sunday evenings are the worst time for me. I get depressed on Sunday evenings. But now I've come to a point where I look forward to Mondays. So I think you work your way towards that.
So what about the younger ones?
I think you need to know what your motivations are. For those who are, the top of the class, yes, but there are a lot of things you can do to challenge yourself if you are in it for the challenge. I think to be a doctor in the long run, you need to have passion for people as well. Yes, there are some branches of medicine that you don't deal as much with people, but before you get to that level, you need to spend maybe at least 2 to 4 years, 5 years dealing with people before you get to that level. So if you want to put yourself in a struggle for 5 years before you get to that part where you don't have to deal with people, I think it's not worth it for me. If you are in it because your parents want you to do it or for other purpose other than because you are really interested in it, then I won't encourage people to do it because it takes a lot of you, and if you don't enjoy it, I think maybe don't do it. Yeah. So for me, what I kind of think doctors were and now is there a disconnect? Not really, because I shadowed those doctors really when I was in it. Then everyone discouraged at the first point, yes. But I fell in love with it, and so it's it's what I have always aspired to do, kind of in a way. But I think if your motivations are different, then maybe you will need to reconsider. Yeah.
Cindy, any advice for the young people?
For me, I think I also I listen from a lot of my cousins and all how being doctor is, and because of your results you have to go to it's naturally like if you are scoring quite well and then get certain result, like some people your family members will push you to do medicine lah. But as what Dr. Teoh and Esther said, like you really need to have a certain passion for people as well, and to remember why you are in it, because the days can get really tough. Like I admit that I also nearly quit housemanship at times because like it is like in this sense it's like quite disconnected because we weren't told of, I mean at that point of time I wasn't prepared for the how harsh housemanship will be, like how in a sense what everyone would call it as a very toxic environment, and some of my friends and also even they are actually under psychiatry follow up for depression because they couldn't handle and things like that. So to actually consider and not to just go in for the sake of money and or for the sake of glamour or anything, you have to really consider whether is it worth it or not. So like whether is it worth your mental health, whether is it worth time, whether is it worth all the investment and being in debt or anything after that many years now. So it's to like really pray about it and also like seek realistic expectation, not just the painted one. Like don't hear it from Grey's Anatomy or anything like that now.
Thanks. For me, it's not disconnected. It is exactly what I expected, and I think the passion is very important. Passion for your work, and passion for people. That's driving me to do what I want to do. And until today, I still enjoy what I'm doing, even though what I'm doing is very routine. Put people to sleep, and then make people numb, and then work along to work with the surgeon, all that. I still enjoy whenever I anesthetize my patient. I enjoy whenever I put the spinal in. I enjoy every time I put the epidural in. I still kind of enjoy it. You ask me to stop working, I still don't want to stop yet. I think for the young people, whatever you want to do, you need to have passion for it. Whether it's engineering, whether it's to be a teacher, if you have the passion for it, no one can stop you. Even there's a wall in front of you, you break the wall, you make a door out of the wall, you open the door and walk through it. So that's a passion. So everyone's got the passion that God has put in our heart. So we just work along your passion, ask God to empower you, and go for it. All of you can make it, if you have passion, the God-given passion, not passion for something selfish, passion for money, passion for position, that you won't enjoy your work. Okay, so I think we come to the end already, right?
One more question, Ken, before you end.
Sure.
Yeah. But one last question is, I know you here, all four of you are actually doctors, but in medical area, they are more than just doctors, right? They are nurses. There are also people in emergency. I don't know what you call it. People in the ambulance and all this. So can you share a little bit about that, or is that out of the scope for? I mean, you work with them a lot, so how can you share a little bit on that area?
Want to go first, Boon? You got a lot of assistants in OT.
Yeah, maybe what other than doctors, what other people are in the hospital? Like to help a person heal.
So I think sometimes doctors are quite full of themselves. They think the world revolves around them, especially surgeons. In time, you will learn the hard lesson that actually you need the whole team. And there are a lot of people who I don't think are behind the scenes. Number one, first and foremost, will be nurses. So maybe when we had this talk about medical, maybe we should have gotten nurses in. So because if you talk about being with patients and spending time with them, relationship, I feel that my nurses know the patients much better because they spend hours, one shift, maybe 8 hours, 10 hours sometimes with the patient. So they really know. And I find out from patient. Find out about the patient from the nurses. The nurses will tell me, this one got 2 wives, or these children on that, So sometimes not relevant, but sometimes it's relevant, especially the social history. So I always salute my nurses. Besides nurses, then there are physiotherapists. So physiotherapists are the people who help patients recover from, say, for example, an accident and all that. So they have to exercise their limbs or part of their bodies, to get better. Then there are also occupational therapists, which help patients to let's say they had a stroke, and now they can't do something like button a shirt. So they help a patient to get around it, or maybe hold a spoon. So they'll find a way to maybe make a special spoon for them or something like that. This is very, very, very basic explanation. If you have a occupational therapist, they'll probably hit me over the head and say, no, we don't do that. More than that. But that is what we see. Then then there are radiographers, there are people who take x-rays, who do CT scans, there are orderlies, people who transport patients from one place to another, ambulance drivers and all that. So it depends on what the passion is. But like what Soo Hin says, passion is the most important thing. People think that some people think that there's the only one job that makes is worth it, and people tend to think, doctor, that's the most honorable, noble job. But it's actually it is any job. So you can help people in any job. The most important thing is to have passion. So a wise friend once told me that if you do what you like, you never have to work another day in your life. So work doesn't seem like work anymore. So that is very true, because everybody's idea when you're young is I want to become millionaire by the time I'm 28 or 30, and retire. I tell you, I cannot. If I had to stop working at 30, I'll be bored of my skull. I actually don't like vacations and all that. When I'm on vacation, I'm thinking, when can we go back? I haven't done this operation so long. My hands are itchy. I get withdrawal. So I think just want to say that. Just find your passion, and then the time will just go. Okay, sorry.
Yeah, it's the same with me sometimes. Especially if I take leave just to relax at home, then I'll miss going back to work. Okay. Does that answer your question, Chun?
Yeah, that does. Because you see, I go to the hospital, I see so many different people running around, and usually you hardly see the doctors. Only once in a while.
Especially people like me.
Behind the curtain.
Yeah.
Okay, Rina, do you want to tell the young people about that shadowing thing if they are interested? No?
Yeah,
To-
we actually planning with Chun. We'll sit down and see whether the we could have a sort of a schedule coming up where the youth, they can sort of sign up to shadow. Maybe Boon, I don't know, through Adventist, and then maybe with Soo Hin through Lo Guan Lai. I don't know what would the time frame be, but we will take this offline with you guys and then see how we can go about it. I think Cindy, you're in.
Some of the
Sorry?
field also. You want to tell
Yeah,
them
we
about
will do it. Yeah, we
Yeah.
will also look into all the other fields. I think like the startups, maybe engineering. We have to talk to Kin On, and then Chun, or some contacts in the finance, so that we could actually come up with a system so that they can just sign up, because the young people that are watching in, and they will also watch the recording, is that they're around the ages of, say, 16, 17 to about 18. So they're just at that point of leaving and to start college. So it'll be good to expose them to the different fields. If that's what they really want to do, then they can make a wise decision. We want them to think carefully, and so that they can it's no point starting something and then halfway through say, oh, this is not what I want. We want to help them to make a good decision for themselves. So we will take this up with all of you. But Cindy and Esther, you guys are not here, right? You all, Cindy, I know, is in Miri, and Esther is also
Typing.
Esther is typing.
Yeah.
Typing. Well, anyway, if anybody's interested to go for a week in typing, they could. But yeah, we'll take it up this offline with all our panelists.
Yeah. Rina, thank you. That's a good idea. I think what I think we can do is maybe talk to each of the young people, see what their areas of interest, after listening to 8-9 sessions now of various different fields of career, we can I guess that's probably easier, Rina. We talk to them, find out what areas they are interested in, and then we can try to locate the panelists and see if they can take them in for a day, a week. I don't know how long it needs. Yeah.
Yeah. Okay.
Yeah.
So,
Yeah. Thank you, everyone, for.
thank you so much. Chun, do you want to close with a prayer?
Sure, I
We
can.
go?
Yeah.
Before that, I want to thank Cindy, Esther, especially to come on board. So nice to meet you all. Hopefully, we can keep in touch. So, go for your dream of becoming physician and psychiatrist, and wish you all the best. And we keep praying for both of you. All right.
Thank
Thank
you.
you.
And keep running, Esther. Don't stop.
Esther, I fully understand how you feel because I cycle a lot,
Oh,
hours, and that's my best time with God always.
Yeah, thanks
yeah.
Boon Wei also for
Yeah.
being the uncle here, and
Yeah.
both of us are uncles
Okay, let me pray for all of us. Dear Lord, what a privilege it is that you have arranged for us to meet virtually tonight, and also able to record this session, that we can allow other listener to listen into the session. Lord, thank you for the life you give each one of us here tonight. Lord, I especially want to pray a blessing upon Dr. Cindy, Dr. Esther, Dr. Boon Wei, Dr. Soo Hin, that you will bless them with your presence all the days of their lives, Lord. And I also ask you to bless their families to a point beyond their imagination, Lord. That everyone in their family will feel your love. Lord, I also want to pray for all the listener here tonight, and also those that will be dialing in to listen to the recording, that that not only they will be inspired by the sharing tonight, but they'll be inspired by you, Lord. That they will realize that you are such a glorious God and loving Father, Lord, that it's worth to leave everything to chase after you, Lord. Thank you, Father, for the life you have given us. In Jesus' name I pray. Amen.
Amen.
Thank you, everyone.
Good night. Good night. Happy Chinese New Year.
Yeah.